Hello everyone, good morning. My name is Dr. Ashok Agarwal from Cleveland, Ohio. I am really pleased and honored to be a speaker at Sri Lanka Association of Urological Surgeons annual meeting. I'm going to be talking today about a topic which is really has generated a great deal of interest is on idiopathic male infertility. So I want to talk to you about the new research that has been conducted and published on how to diagnose and manage this condition at this time. So let me begin. So these are some of the learning objectives of my talk. I'm going to talk about the incidence of male infertility around the globe. What are the key causes for rise? Define idiopathic male infertility, but also talk about MOSI or male oxidative stress infertility, and talk about the role of nutraceuticals in male infertility, and leave you with some of the expert recommendation after showing you some of our clinical trials. So the key causes for the rise in male infertility is really, I think, well known in terms of conditions such as varicocele, infection, blockage, and trauma. These are the things that are known to all of our urologists and andrologists. But the things that I believe have become much more I think easier for us to understand are the involvement of a lot of environmental and lifestyle factors. Certainly, these include changes in our society where late marriages in terms of both for men and women have become quite common. For men over the ages of 35 and 40 is not something which is terribly anything wrong. And also for women or for girls above the ages of 30 is not uncommon. Actually, it is quite common in both west and eastern part of the world. And there is a great decline in semen quality all over the world. We are seeing a decline of as much as in the last 50 years of 50 to 60% decline, whether it is in semen volume, count, motility, or morphology. The semen quality around the world have declined, and there are so many studies, so many meta-analyses that have shown that the semen quality is declining, and this is the reason that the World Health Organization, which publishes its standard manual for evaluation of semen sample, has come out with 6 different manuals in the last 40 years, starting from 1980 to now the 6th edition, which came in 2021, which shows a decline or adjustment of the reference values of all the semen parameters from a high of 80% for sperm morphology to now less than 3% for considering it to be normal by strict criteria. There is also an explosion of sexually transmitted diseases among the young population, and there are environmental reasons such as phthalates, bisphenol, and all of these things which are around us, and they are like silent agents which are causing changes which we don't see for years after years, but they may express themselves in even in the children that are born. There are certain chemicals such as phthalates which are called forever chemicals. They are present all around us in our kitchen, in our living room, and you can never get rid of them. They are in everything that we breathe and eat. They are present. You should read about it. And then there are occupational exposure, air pollution, which is all around. It's not just by the automobiles, but by industry, by airlines, by aircrafts, by so many things which are creating the pollution. Lifestyle factors, sedentary lifestyle. This is not because of the pandemic, but even before we have changes in our lifestyle where people are not really traveling. They are not walking around in the park and going around to your friends and having a cup of tea. Those days are gone. We don't have anybody. You cannot go to somebody's house and say, well, listen, I just came by to say hello. And they will say, I don't know who you are. I'm going to call the police, at least in the United States. You cannot go anywhere. You have to make an appointment to visit even your friend. And the studies that we had conducted using cell phone have shown that excessive use of cell phone over at least 2 to 4 hours per day can result in adverse semen quality. Of course, it affects our health, but also it can reduce semen quality. We published it in Fertility Sterility almost about 8 or 10 years ago, and since then, large number of papers have come out. So I just wanted to tell you about what are the things that are really resulting in an explosion in the causes of infertility. But let's talk about the global incidence of male infertility, and this is a good slide to really learn about that. There are about 200 million infertile couples according to the WHO paper in 2004 in Human Reproduction, but that study is almost 20-year-old, and knowing WHO and government agencies, they always report the things rather in a very conservative manner. So I will not be surprised these numbers are more than 350 to 400 million. Taking into account about half of all causes of infertility involve male factor. If you look at that, that is almost close to 100 or maybe 200 million. And in at least half of them, we know causes like varicocele that you can operate, or you have blockage, or you have azoospermia or non-obstructive azoospermia. You can retrieve the sperm and you can do things. But in other half, what we have is a condition called idiopathic male infertility. So here we are in this group of patients which are diagnosed as idiopathic. The major thing that we have seen and others, that 80%, up to 80% of these men have what we call as oxidative stress. And this constitutes almost 40 million men who have idiopathic infertility with high oxidative stress. So what is the difference between idiopathic and this new condition that we have coined as MOSI? So let's learn about it. Idiopathic is essentially abnormal semen quality with or without female factor, while MOSI or male oxidative stress infertility is a condition which is defined as with abnormal semen quality, high oxidative stress, no female factor, and no other identifiable cause, either anatomical, endocrinological, or genetic cause that can be found on physical examination. So let's learn about the concept of oxidative stress very briefly. Oxidative stress is a condition that is known to us in over 100 human diseases, in cardiothoracic to cancer to Alzheimer to anything that you know. Oxidative stress is behind the etiology of those conditions. Now, in terms of the sperm, we have learned over the last 50 years that sperm are very special kind cells which are highly susceptible to oxidative injury. Oxidative or generation of free radical is a constant thing by all living cells. But the sperm being a cell which undergo a process where during the generation from spermiogenesis, where the round spermatid loses most of its cytoplasm as it becomes elongated, and it loses most of its endogenous enzyme which can protect the cell from oxidative insult. Furthermore, sperm plasma membrane is very rich in polyunsaturated fatty acid, and it is prone to oxidative insult due to the process of lipid peroxidation. So now, knowing a little bit about oxidative stress, which is not a unique condition, which is an imbalance between the oxidants and antioxidants, and it is something that we require in a physiological condition. Very small amount of free radicals or group of free radicals are required for successful processes leading to fertilization, such as acquisition of motility, acquisition of acrosome reaction, or capacitation. All of these events require a small amount of free radicals. But if there is an imbalance, it causes oxidative stress. And if you look at the right side of this figure, you will see that these are the triggers which causes oxidative stress, either immature sperm, leukocytes, varicocele, or lifestyle factors such as fatty acid, smoking, fatty diet, sorry, smoking, drug addiction, etc. And all of these are triggers which generate high amount of oxidative imbalance. And it is a potentially treatable condition. Male reproductive potential cannot be adequately evaluated if we overlook seminal oxidative stress. However, the doctors and the clinicians had no way to really measure oxidative stress in a standardized manner, in an easy manner, in a diagnostic lab or IVF clinic, because there were no simple techniques which were available. So even though many of us knew about oxidative stress, we didn't know how to really treat it. Sorry about that. So let's learn about oxidative stress in fertility. This is a concept that we proposed and published with a group of 90 authors, specialists from 6 continents and 26 countries. And we proposed terminology and clinical practice guidelines for the management of idiopathic male infertility. What is the clinical guideline? MOSI, or male oxidative stress infertility, should be suspected in infertile men with abnormal semen characteristic, whether count, motility, or morphology, whether it is oligospermia, cenozoospermia, or it is teratozoospermic. Any of these conditions, need not all of them to be together. Along with oxidative stress, many of these men were previously classified as idiopathic with no underlying endocrine, genetic, or anatomical causes of infertility. We feel these men should be offered testing for oxidative stress or ORP by myopsis to potentially diagnose MOSI. So let's go to we came out with the algorithm for management of MOSI, and as you can see here, after a quick semen examination, patients can be examined for oxidative stress by a very simple device called myopsis, which measures ORP, or oxidation reduction potential, which is essentially a snapshot of oxidants and antioxidants in one single way. And we have standardized and reported the cutoff value of 1.34 millivolts, above which ORP levels are abnormal or indicate oxidative stress. If there are no other condition along with oxidative stress, then it is considered as pure MOSI. Otherwise, if it has inflammation, leukocytospermia, then they can be treated with antibiotic or anti-inflammatory. If they have lifestyle condition, then they can be counseled. If they have varicocele along with oxidative stress, then varicocelectomy will be the choice of treatment. If they do not have any other comorbid condition, they can essentially be asked for antioxidant supplementation and then retested for ORP. So current treatment modality for idiopathic male infertility is essentially lacks evidence. They are called empirical medical therapy because they are not rational. They are not really supported by randomized clinical trial. They are not supported by professional societies such as AUA or EAU or other organizations such as ASRM. Furthermore, there is no support of the treatment of these from FDA, and there are no randomized large clinical trials supporting the efficacy of any of these treatments, whether it is clomid, anastrozole, or gonadotropins, etc. These are all hit and miss. They may work for few, it's like a placebo, and will not work for many of the patients. So antioxidant is one of the empirical treatment for idiopathic male infertility. Now let us learn about antioxidant. What are the benefits of it? Well, it can address the underlying causes in cases of patients who are diagnosed to have MOSI. It avoids the side effects of empirical medical treatment as well as the high cost of hormonal treatment. It avoids the high cost of unsuccessful ART, and it's relatively safe, cheap, and more widely available. So, what are the indications for treatment with antioxidant? And these are some of the indications: repeated IVF, IUI failure, varicocele, older men above the ages of 40, history of infection, smoking, idiopathic or unexplained infertility, and recurrent spontaneous abortion. Now, coming to antioxidant, we all feel quite worried about using the antioxidant because there is no consensus of the efficacy of antioxidant for treatment of male infertility with the studies and trials and meta-analysis providing all kind of results in both directions. No efficacy or it works in improving the semen quality. So what should we trust, what we should not trust, and because of that there is a great deal of suspicion about the efficacy of antioxidant. Many people think it is essentially a placebo. Well, I want to share with you some clinical trials where we were involved along with our colleagues, and this is one of them which was reported and published in a high impact journal recently. It included about 150 infertile men, and they were treated with antioxidant 3 tablets twice daily for 3 months, and routine and advanced semen examination was done before and after antioxidant treatment. And the most of these men, as you can see, were positive for ORP, and they were almost 90% of them had high oxidative stress. And they were treated with the antioxidant, which contained a large number of ingredients which are now common in many good quality antioxidants. So these antioxidants have significant research that have shown the efficacy of individual ingredients such as vitamin C and E, improving the concentration, or L-carnitine, which improves the total motility, or lycopene, which reduces the lipid peroxidation or DNA damage. So there are large number of studies both in vitro and in vivo which show individual effects of these antioxidants. Also, there is this is the data from our study which we have published, and it shows the results, the yellow bar before antioxidant supplementation and the green bar after the antioxidant supplementation. You can see there is a significant improvement in all semen parameters. There is a 55% increase in concentration, 16% rise in motility, and almost 143% increase in progressive motility. And progressive motility is the most important parameters of sperm because it is the population of sperm which is the one which moves in a straight line manner. So this is the most important population which is important for fertilization, both for natural and for assisted reproduction. Furthermore, the sperm morphology by strict criteria showed significant increase after antioxidant supplementation. There was also a significant decline in oxidation reduction potential, which is a good thing. There was a significant decline in sperm DNA fragmentation, which is also a good thing. We also wanted to go because there is a great deal of concern about how antioxidants which are taken orally go through the bloodstream and can go through the blood testis barrier and cause a change into the testis sperm producing cells, Sertoli or Leydig cells, to cause all these changes in terms of improvement in semen quality. Because nobody has shown what is the mechanism of these changes, how these changes are really happening. And there is a great deal of suspicion about it. So we wanted to conduct a study because of our expertise in proteomics of sperm proteomics for a large number of years. So we conducted it to understand what proteins are behind the changes that we are seeing in motility, in morphology, or reduction of oxidative stress, or improvement in sperm count. If we can identify them, if they are really changing as a result of taking the antioxidant, then we know that there is a molecular pathway which is really behind the changes that we see at the microscopic level. So this again study was published in a high impact journal, and you can read it. It is published in a journal called Antioxidant. This slide is basically, it's a long paper which summarizes everything that is important for you to understand. So this is the result of the Western blot validation of the results of the proteins that we found are most important in terms of various sperm function of interest. So this is again the yellow bar is showing the protein expression by Western blot before and after the protein after antioxidant supplementation. CCT3 is a protein which is responsible for sperm binding. So the level of this protein is significantly increased. NDUFS is the protein which is responsible for controlling the oxidative stress, and you can see that protein level has increased tremendously after antioxidant, showing that it will decrease or it can control the oxidative damage, which is really behind the condition of MOSI or male oxidative stress. And picaria 1 is the protein which is responsible for improvement in sperm motility, and you can see that again is significantly increased after antioxidant supplementation. What does it tell? It tells that we now, for the first time in the world, this study is for the first time in the world demonstrate the molecular mechanism of antioxidant supplementation. Nobody has shown that as to how this happens. And people think this is a voodoo science that people are giving antioxidants. Some studies find there is a change, others find no change. So what the heck is going on? Well, ladies and gentlemen, antioxidant supplementation has beneficial effect in a correct population of patients in terms of on their sperm function protein, which are associated with fertility at the molecular level. This is the most important finding in the world. Now, this is another study which I wanted to share quickly before I finish my talk, is on the impact of antioxidant treatment on natural pregnancy outcome and semen parameters. This is a systematic review and meta-analysis of randomized controlled trial. This is a study which is the granddaddy of all meta-analysis in the world, because we included every single paper that is published from the very beginning of the literature to now in every possible language. We translated every possible language, whether it is Russian, Chinese, German, anything and everything. We had so many researchers who were working on this study. We had 1,300 papers that were collected, which were hand checked, and we basically collected only the randomized controlled trial. We had 45 randomized controlled trial, the largest number of randomized controlled trial which were included in meta-analysis for the very first time in the world. And what we found, and you can see this is a forest plot which shows all the studies that were included, and these studies have looked at, these are all clinical trials which have done antioxidant, different type of antioxidants, and they have reported their results in terms of clinical pregnancy rate. And you can see if on the left side, if the diamond shows on the left side, that means there is no effect. On the right side, it means there is an effect. It favors the treatment. So no improvement or favors the treatment. So here the diamond shows on the right side of this line, all the studies show improvement. So what it means is that treatment with antioxidant of various types, this is not just one single type, in different population of patients, improves clinical pregnancy rate compared to placebo or no treatment. This is a major finding. To put all different studies in one basket, and despite their differences, these are all randomized controlled trials, we are able to demonstrate that there is a significant improvement in clinical pregnancy rate, there is a significant improvement in progressive sperm motility, there is a significant improvement in total sperm motility, as you can see. there is a significant decrease in the levels of oxidative stress. There is an increase in the intracellular antioxidant level. Furthermore, we wanted to summarize these findings in terms of the use of antioxidant. We propose the antioxidant can be used to improve the spontaneous pregnancy rates in patients diagnosed with idiopathic male infertility after a careful diagnostic workup and exclusion of major causes of infertility. Second, antioxidant use can be recommended to improve conventional sperm parameters in couples diagnosed with idiopathic male infertility, again after a careful diagnostic workup and exclusion of other causes of infertility, antioxidant can improve the seminal oxidative stress levels in patients diagnosed with male oxidative stress infertility. So to conclude, idiopathic male infertility is a broad diagnosis that can be an emotional burden and a financial strain for the couple. Current practice habits for treatment of idiopathic male infertility are not evidence-based. Doctors and patients must consider oxidative stress as a cause of poor sperm health. MOSI is easy to diagnose. The test takes only 2-3 minutes. Anybody without training can conduct. It has broad worldwide consensus, is evidence-based, and could be successfully treated. High quality research supports the use of antioxidant supplements to combat oxidative stress and improve sperm health in cases of male oxidative stress infertility. This was the slide for BJUI, which supported this presentation. And thank you very much from Cleveland, Ohio. Thank you.